Her hands shook over the chart marked in red. Lila Carter saw the allergy warning, glowing like a wound that wouldn't heal, a single word that could split the difference between breath and stillness. She warned Dr. Hargreaves, the surgeon whose reputation filled rooms before he entered them, but his dismissal came wrapped in institutional ice. Eleanor Whitmore, the mayor's wife, lay unaware on the table as the syringe filled with poison her body would reject. The shot entered her vein like a match striking gasoline. What happened next would shatter the glass between competence and catastrophe, forcing a man drunk on his own legend to witness what arrogance truly costs. Subscribe to see how one ignored voice became the difference between tragedy and survival. The fluorescent lights of Mercy Heights Hospital hummed their relentless mechanical song, casting everything in that peculiar shade of white that erased warmth and transformed human skin into something clinical and distant. Lila Carter stood at the nurse's station on the 4th floor, her fingers trembling slightly as they traced the edge of the medical chart she'd been reviewing for the past 10 minutes, the paper thick and official beneath her touch. She was 24 years old, young enough that some patients still mistook her for a volunteer, her face carrying that softness that hadn't yet hardened into the mask most veteran nurses wore like armor against the daily parade of suffering. The chart belonged to Eleanor Whitmore, 42, wife of Mayor Richard Whitmore, a woman whose name carried weight in Raleigh's political circles, whose photograph appeared in society pages wearing pearls and practiced smiles. But what held Lila's attention wasn't the patient's prominence or the detailed surgical notes. It was the red sticker positioned at the top corner of the file, bright as a warning flare, with 3 letters that made her stomach clench. Severe penicillin allergy, documented in capital letters, underlined twice by whatever intake nurse had first recorded it. The notation was impossible to miss, screaming danger to anyone trained to read these documents, yet Lila felt that familiar dread creeping up her spine. The same feeling she'd carried since her 2nd year of nursing school, when she'd watched a senior resident override a colleague's concern and turn a routine procedure into a code blue that still haunted her sleep. She glanced around the sterile hallway, watching doctors and nurses move with that choreographed efficiency that came from years of repetition, each person locked into their role within the hospital's invisible hierarchy. Dr. Mason Hargreaves was scheduled to administer the pre-surgical antibiotic in 20 minutes, a routine part of the protocol before Eleanor Whitmore's gallbladder removal. A procedure so common it was practically autopilot for a surgeon of his caliber. Hargreaves was 48, silver-haired and square-jawed, the kind of doctor who appeared in hospital fundraising materials and medical journal features, his curriculum vitae reading like a greatest hits collection of surgical triumphs spanning 2 decades. Lila had only worked at Mercy Heights for 8 months, still navigating the unspoken rules that governed interactions between nurses and attending physicians, especially surgeons, especially men like Hargreaves, who carried their accomplishments like medals pinned to invisible sashes. She'd seen him in the halls, watched how others deferred to him, noticed the way he moved through spaces as if walls might part at his approach. His confidence so absolute, it seemed to generate its own gravitational field. The other nurses spoke of him with a mixture of admiration and wariness, acknowledging his skill while quietly sharing stories of his impatience, his tendency to dismiss concerns raised by anyone he deemed beneath his expertise. Lila had never directly interacted with him until now, had never needed to challenge him. But the red sticker on Eleanor Whitmore's chart glowed in her peripheral vision, like an alarm she couldn't silence. The protocol was clear in theory. Verify allergies, cross-check medications, ensure every detail aligned before anything entered a patient's bloodstream. But theory dissolved in the face of institutional power, in the presence of surgeons who'd performed thousands of procedures without incident, who viewed caution from junior staff as insulting suggestions that they might be fallible. Lila had heard the stories from older nurses, the quiet warnings whispered during night shifts about picking your battles, knowing when to speak, and when silence was the price of keeping your job. She thought about her student loans, about the apartment she shared with 2 roommates, about the career she'd worked so hard to build after growing up in a trailer park outside Durham, where healthcare meant the free clinic and prayers. Her mother had cleaned houses for doctors' families, had scrubbed their toilets and folded their laundry while they saved lives and collected accolades. And Lila had promised herself she'd join the ranks of those who healed rather than those who served them. But standing here now, clutching this chart with its screaming red warning, she felt the weight of every power dynamic she'd ever navigated. Every time she'd been made to feel small because of her age or her accent or the zip code where she'd been raised. The fluorescent lights buzzed overhead, indifferent to her internal war, as footsteps echoed from the far end of the corridor, steady and confident, the unmistakable sound of Dr. Hargreaves approaching for his pre-surgical rounds. Lila's heart hammered against her ribs as she forced herself to step away from the nurse's station, the chart pressed against her chest like a shield. She could see him now, striding toward her with that particular surgeon's gait, unhurried but purposeful, his white coat crisp and spotless, a stethoscope draped around his neck more as symbol than tool. His face held that expression she'd come to recognize in senior physicians, a sort of pleasant detachment, features arranged in professional neutrality, while eyes remained distant, already calculating the next procedure, the next decision, the next triumph to add to an already impressive collection. He didn't acknowledge her as he passed, moving toward the surgical prep area where Eleanor Whitmore waited, sedated and trusting, unaware that her life might pivot on whether a young nurse found the courage to speak. Lila's training screamed at her to follow, to intercept, to force him to see what the chart declared in impossible-to-miss notation. But her feet felt welded to the linoleum floor, her throat constricting around words that suddenly seemed presumptuous, almost arrogant in their implication that she might know something he'd missed. She thought of her nursing instructor's words from graduation. Your job is to be the patient's advocate, even when it's uncomfortable, especially when it's uncomfortable. But comfortable was a luxury afforded to those with tenure and protected positions, not to young nurses still proving they deserved to occupy space in these hallowed halls. The distance between her and Dr. Hargreaves widened with each passing second, and she felt that familiar paralysis that came from knowing what was right while drowning in the institutional quicksand of hierarchy and consequence. But then she saw Eleanor Whitmore's face in her mind, not the society page version with professional makeup and perfect lighting, but the woman she'd met during intake yesterday, nervous and kind, making self-deprecating jokes about being afraid of needles while gripping her husband's hand. Eleanor had asked about Lila's family, had commented on her earrings with genuine warmth, had treated her like a human being rather than a medical functionary, a small kindness that meant more than Eleanor probably realized. That memory cut through the paralysis like a scalpel, sharp and clarifying. And Lila found herself moving before conscious thought could stop her, her sneakers squeaking against the floor as she hurried after Dr. Hargreaves. She called his name. "Dr. Hargreaves, excuse me, Dr. Hargreaves," her voice carrying that apologetic tone she hated hearing in herself, the automatic deference that came from years of being taught not to take up too much space. He stopped but didn't turn immediately, and she watched his shoulders shift in what might have been a sigh before he pivoted to face her, his expression polite but impatient, eyebrows raised in a silent question that somehow communicated both inquiry and irritation. Lila held up the chart, her fingers white-knuckled around its edges, and forced herself to meet his eyes. To speak the words that might save a life or cost her credibility, possibly both, as the fluorescent lights continued their indifferent hum and the hospital carried on its endless rhythm around them. "Dr. Hargreaves, I need to verify something about Mrs. Whitmore's chart," she said, her voice steadier than she felt, though she heard the slight tremor at the edges. She opened the file to the allergy page, pointing to the red sticker with its unmistakable warning, her finger hovering over the notation like a lawyer presenting evidence. "She has a documented severe allergy to penicillin. It's marked here and in 3 other places in her file. I saw that the pre-surgical antibiotic order includes a penicillin-based medication, and I wanted to make sure we're aware before administration." She kept her tone professional, factual, stripped of accusation or judgment, offering him an easy path to acknowledge the discrepancy without suggesting incompetence. But she watched something flicker across his face, not gratitude or concern, but something closer to offense, as if her simple verification had somehow challenged his entire identity. He glanced at the chart with barely concealed impatience, his eyes skimming the page for perhaps 2 seconds before looking back at her, with an expression that made her feel suddenly very young and very foolish. The moment stretched between them like a wire pulled taut, and Lila understood with sinking certainty that she'd miscalculated, that her attempt to protect a patient had somehow become an insult to a man whose ego was more fragile than his surgical skill was sharp. Dr. Mason Hargreaves looked at Lila Carter with the kind of patience one might extend to a confused child, his lips curving into a smile that didn't reach his eyes, a practiced expression that simultaneously acknowledged her presence while dismissing her concern. "I appreciate your diligence, Nurse Carter," he said, his voice carrying that particular blend of condescension and courtesy that marked territorial authority. "But I've been administering pre-surgical antibiotics for longer than you've been in nursing school. I'm well aware of Mrs. Whitmore's medical history." He handed the chart back to her, with a gesture that managed to be both polite and dismissive, a physical punctuation mark to the conversation he clearly considered finished. Lila felt heat rise in her cheeks, that familiar flush of humiliation mixed with frustration, but she forced herself to hold her ground, her training warring with her instinct for self-preservation. She tried again, her voice quieter now, more tentative despite her best efforts. "I understand, Doctor, but the order in the system shows cefazolin, and I just wanted to confirm—" He cut her off with a raised hand, his patience visibly thinning, the pleasant mask slipping just enough to reveal the irritation beneath. "Nurse Carter, I've done this 1,000 times. 1,000 times. I don't need a chart to tell me how to do my job." His tone had shifted from patronizing to sharp, each word carefully enunciated as if speaking to someone who didn't understand English. Around them, other staff members had slowed their movements, pretending not to listen while absorbing every word of this minor drama playing out in the hallway, and Lila felt the weight of their attention, like physical pressure against her skin. The hierarchy of the hospital was never more visible than in moments like these, the invisible stratification that placed surgeons at the apex, and everyone else arranged in descending tiers of authority and expendability. Lila knew the rules, even if they were never explicitly stated. Nurses questioned doctors at their own risk, especially young nurses, especially female nurses, especially when the doctor in question was someone like Mason Hargreaves, whose reputation functioned as both shield and weapon. She'd watched this dynamic play out in countless small interactions since starting at Mercy Heights. The subtle ways power flowed through the institution, how certain voices carried weight while others evaporated into the sterile air. Dr. Hargreaves embodied everything the medical establishment revered: Ivy League education, published research, a string of successful surgeries that decorated his office walls in framed commendations and grateful letters from patients whose lives he'd saved. He'd performed heart transplants in Boston, trained residents at Johns Hopkins, consulted on cases that made national news, and his presence at Mercy Heights was considered a coup for the hospital's administration. Lila, by contrast, was a state school graduate with no publications, no specializations, no pedigree beyond hard work and student debt. Her authority extending exactly as far as her immediate tasks and not an inch further. She understood the mathematics of the situation, could calculate the cost-benefit analysis of pushing back against someone whose displeasure could poison her career before it truly began. But the red sticker on that chart burned in her mind like a brand that wouldn't fade. Eleanor Whitmore remained in the pre-surgical suite, unaware of the power struggle unfolding over her unconscious body, her trust absolute in the institution and the people who wore its uniforms. Lila thought about that trust, how fragile it was, how easily it could be betrayed, not through malice but through ego, through the dangerous assumption that experience exempted anyone from error. She'd seen it before during her clinical rotations, brilliant physicians making catastrophic mistakes, not because they lacked knowledge, but because they'd stopped believing they could be wrong, their confidence calcifying into arrogance that blocked out contradictory evidence. Her instructor's words echoed again. Arrogance kills more patients than ignorance ever will. Doctor. Hargreaves was already turning away, the conversation finished in his mind, his attention shifting to the surgical prep he needed to complete, and Lila stood frozen in the hallway, clutching the chart that everyone else seemed determined to ignore. She could let it go, could file the chart and move on to her other patients, could protect herself by staying silent and hoping for the best, reasoning that surely someone else would catch the error, that the system had redundancies built in for exactly this kind of situation. But she also knew how systems failed, not spectacularly or obviously, but through small moments of deference, through accumulated silence, through thousands of individual decisions to trust authority over evidence because challenging power felt too dangerous or too exhausting. The operating room beckoned Dr. Hargreaves forward, its doors swinging open with that pneumatic hiss that marked the boundary between the regular hospital and the surgical theater where miracles and tragedies occurred with equal frequency. Lila watched him scrub at the sink with methodical precision, his movements automatic after decades of repetition, each gesture economical and practiced. Other surgical staff moved around him like satellites orbiting a sun, the scrub nurse laying out instruments with careful precision, the anesthesiologist reviewing his own charts and preparing his equipment, everyone performing their assigned roles in the choreographed dance of a routine procedure. Eleanor Whitmore lay on the table draped in surgical blue, her face peaceful in sedation, her body positioned and prepped according to protocol, monitors displaying her vital signs in steady, reassuring rhythms. The room hummed with the background noise of medical machinery, the soft beep of monitors, the whisper of ventilation systems keeping the air sterile and cool, an environment designed to reduce human factors to minimum variables. Dr. Hargreaves entered with his hands raised, allowing the scrub nurse to help him into his surgical gown and gloves. And Lila could see through the observation window how completely he inhabited his role, how the operating room transformed him from merely confident to something closer to invincible. This was his domain, his kingdom, and everyone present existed to support his decisions, not question them. But Lila couldn't let it go, couldn't ignore the voice in her head that screamed danger, that replayed the moment from nursing school when she'd stayed silent and watched a patient's condition deteriorate because she'd been too intimidated to challenge a resident's call. That failure haunted her still, visited her in quiet moments when she questioned whether she had what it took to be the nurse she'd promised herself she'd become. She'd left that clinical rotation, carrying the weight of her silence like a stone in her chest, had almost quit nursing school entirely because the guilt felt unbearable, because she couldn't reconcile the person she wanted to be with the coward who'd let fear override duty. Her instructor had talked her through it, had helped her process the trauma and transform it into determination, had made her promise that she'd never again choose her comfort over a patient's safety. That promise felt like a living thing now, demanding acknowledgement, and Lila found herself moving toward the operating room entrance before she could talk herself out of it. She pressed the intercom button that connected to the surgical suite, her heart pounding so violently she thought it might bruise her ribs from the inside. Dr. Hargreaves looked up from his prep, his eyes meeting hers through the observation window, and she saw the flash of annoyance that crossed his features when he recognized who'd interrupted. The other staff members exchanged glances, the atmosphere in the room shifting subtly as everyone registered this unusual breach of protocol. Nurses didn't interrupt pre-surgical prep, especially not to repeat concerns that had already been dismissed. "Dr. Hargreaves, I'm sorry to interrupt," Lila said through the intercom, her voice crackling through the speaker system. "But I need to emphasize that Mrs. Whitmore has a documented severe penicillin allergy, and the antibiotic you're about to administer falls within that category. I strongly recommend we verify the order before proceeding." She spoke quickly, formally, trying to frame her concern in language that couldn't be dismissed as mere nervousness or inexperience, but she watched his expression harden into something cold and immovable. He didn't respond immediately, instead turning to his scrub nurse and saying something too quiet for the intercom to catch, and Lila saw the nurse glance toward the observation window with an expression that mixed sympathy with disapproval. Then Dr. Hargreaves looked directly at her, his voice when it came through the speaker system carrying an edge that made several people in the hallway slow their steps to listen. "Nurse Carter, I don't know how things were done at whatever program you attended, but at Mercy Heights, we trust our surgeons to make appropriate medical decisions. I have reviewed Mrs. Whitmore's chart. I have made my clinical judgment, and I am telling you, for the final time, that I know exactly what I'm doing. Now please step away from the intercom and allow us to proceed with the surgery." Each sentence landed like a hammer blow, and Lila felt her face burning with humiliation as the handful of staff members nearby suddenly found urgent reasons to be elsewhere, unwilling to be associated with this public dressing down. She released the intercom button, her hand shaking, her eyes stinging with tears she absolutely refused to let fall, and watched through the window as Dr. Mason Hargreaves picked up the syringe containing the antibiotic he'd selected. His movements deliberate and unhurried, a man so certain of his righteousness that the possibility of error literally couldn't penetrate his consciousness. The syringe gleamed under the surgical lights as Dr. Hargreaves held it up to check the dosage, the clear liquid inside catching the brightness and refracting it into tiny prisms that scattered across his gloved hand. Eleanor Whitmore lay still beneath the drapes, her breathing regulated by the ventilator, her body surrendered completely to the expertise of strangers who would cut into her flesh and rearrange her internal geography while she floated in chemically induced absence. The anesthesiologist nodded his readiness, having already administered the cocktail that would keep her unconscious and pain-free throughout the procedure, his own monitors displaying a stable baseline that gave no warning of the catastrophe about to unfold. Dr. Hargreaves approached the IV line with the casual confidence of someone who'd performed this exact action thousands of times before, just as he'd told Lila, his muscle memory guiding movements so familiar they required almost no conscious thought. The scrub nurse stood ready with instruments arranged in precise order on the sterile field, every tool positioned exactly where his hand would expect to find it, the choreography of surgery reduced to clockwork precision through endless repetition. Outside the observation window, Lila Carter stood with the chart still clutched against her chest, her knuckles white, her breathing shallow, watching with a mixture of dread and desperate hope that maybe she was wrong, Maybe her concern was unfounded. Maybe his experience truly did supersede the screaming red warning that nobody else seemed to take seriously. The moment stretched into something elastic and strange as Dr. Hargreaves connected the syringe to the IV port, his thumb positioned on the plunger, ready to deliver the antibiotic that would theoretically prevent post-surgical infection and ensure Eleanor Whitmore's smooth recovery. Lila could see his lips moving as he spoke to the surgical team, probably narrating his actions according to protocol, though she couldn't hear the words through the thick observation glass. The fluorescent lights hummed their endless mechanical song, indifferent to human drama, as monitors beeped their steady rhythms, and the ventilator continued its rhythmic sigh like mechanical breathing. Time seemed to compress and expand simultaneously, each second both infinite and instantaneous, as the clear liquid began its journey from syringe into IV line, pushed by the gentle pressure of a surgeon's thumb, carrying with it the molecular structure that Eleanor Whitmore's immune system would recognize not as medicine, but as enemy, as invader, as threat requiring immediate and overwhelming response. The antibiotic entered her bloodstream with the innocence of any other medication, mixing with her blood and beginning its circulation through her body, reaching toward her heart and lungs and brain, spreading through the network of vessels that kept her alive, even as it carried the seeds of a reaction that would nearly stop that circulation entirely. For perhaps 30 seconds, nothing happened. Eleanor remained stable, her vital signs unchanged, the monitors displaying their reassuring patterns as if everything was proceeding exactly according to plan. Then her body recognized the foreign substance, and the cascade began with horrifying speed. Eleanor's blood pressure, displayed in green numbers on the monitor above her head, began to drop. Slowly at first, just a few points, easy to dismiss as normal fluctuation, but then accelerating, falling with gathering momentum like a stone dropping through water. The anesthesiologist noticed first, his eyes widening as he watched the numbers plummet, his hand already reaching for medications to counter what he was seeing, his voice calling out blood pressure readings in ascending urgency. Eleanor's heart rate spiked in compensation, climbing rapidly as her cardiovascular system tried desperately to maintain perfusion, to keep blood flowing to vital organs, even as her blood vessels dilated in response to the massive histamine release flooding her system. Dr. Hargreaves looked up from his initial incision, his scalpel hovering over Eleanor's abdomen, confusion flickering across his features as the sudden change in atmosphere registered. The scrub nurse stepped back slightly, her eyes darting between the monitors and the patient, professional training warring with the instinctive recognition that something was going catastrophically wrong. The anesthesiologist called out more readings, his voice sharp now, stripped of routine calm, as Eleanor's oxygen saturation began falling, despite the ventilator forcing air into her lungs, her airways swelling in response to the allergic cascade, narrowing the passages through which life-sustaining oxygen needed to flow. The monitors erupted into a cacophony of alarms, different pitches and patterns overlapping into a discordant symphony of medical emergency, each sound coded to communicate specific dangers to trained ears. Eleanor's skin, visible above the surgical drapes, began to mottle with the characteristic flush of anaphylaxis, red patches blooming across her chest and neck like watercolor bleeding through paper, visible evidence of the internal catastrophe as her body waged war against itself. Dr. Hargreaves dropped his scalpel onto the sterile field, his surgical precision instantly abandoned as he shifted into emergency response mode, his hands moving to assess Eleanor's condition with rapid, practiced movements that carried no trace of his earlier arrogance. The scrub nurse was already reaching for the emergency cart, pulling it closer, her movements economical and swift as years of crisis training overrode conscious thought. The anesthesiologist barked orders, calling for epinephrine, for steroids, for antihistamines, for every medication in the arsenal designed to reverse anaphylactic shock. His hands working IV lines and adjusting ventilator settings, while his eyes never left the monitors that displayed Eleanor Whitmore's deteriorating condition. The operating room transformed from a space of controlled precision into organized chaos, every person moving with urgent purpose. The routine gallbladder surgery instantly abandoned in favor of the only priority that mattered, keeping Eleanor alive long enough to reverse what was killing her. Outside the observation window, Lila watched the scene unfold with a sick feeling of vindication mixed with horror, her warning now validated in the worst possible way. Her worst fears materializing in real time behind the glass barrier that separated her from the crisis. She could see Dr. Hargreaves's face as he worked, watched his expression cycle through confusion, recognition, and something that might have been fear, though his hands never stopped moving, never hesitated despite whatever emotions crashed through his mind. Other staff members had gathered at the observation window now, drawn by the sudden flurry of activity and the alarm sounds penetrating into the hallway, creating a small audience for Eleanor Whitmore's fight for survival. Lila felt frozen, useless, her vindication meaningless in the face of watching someone nearly die because she hadn't fought hard enough, hadn't been loud enough, hadn't found a way to make them listen before the syringe connected to the IV port. She thought of Eleanor's kindness during intake, her nervous jokes about needles, the way she'd asked about Lila's family with genuine interest, and the guilt threatened to swallow her whole. The anesthesiologist administered the first dose of epinephrine, the medication designed to counteract the anaphylactic cascade, to stabilize blood pressure and open airways, and give Eleanor's body a fighting chance against its own catastrophic immune response. The seconds ticked by with agonizing slowness as everyone in the operating room waited to see if the intervention would work, if Eleanor's blood pressure would stabilize, if her oxygen saturation would climb back towards safety, if the woman who'd trusted them with her body and her life would survive their collective failure. Gradually, incrementally, the numbers on the monitors began to shift in the right direction. Eleanor's blood pressure stopped its freefall and started to climb, slowly at first, then with gathering strength as the epinephrine took effect. Her oxygen saturation ticked upward, percentage point by percentage point, as the swelling in her airways began to recede and her lungs could once again accept the air being forced into them. Her heart rate remained elevated, but started to stabilize, no longer climbing toward the dangerous territory where cardiac arrest becomes inevitable. Dr. Hargreaves and the anesthesiologist continued their emergency interventions, administering additional medications, monitoring every vital sign with laser focus, ready to respond to any further deterioration with whatever tools remained in their arsenal. The crisis stretched across minutes that felt like hours, each second weighted with the possibility of loss, of tragedy, of a routine surgery transforming into a death that would haunt everyone involved for the rest of their careers. But Eleanor's body responded to the treatment, her immune system's overreaction slowly controlled by the pharmaceutical interventions designed for exactly this scenario, her vital signs creeping back towards stability even as everyone in the operating room remained tensed and vigilant, knowing how quickly anaphylaxis could recur, how fragile this recovery truly was. The alarms gradually silenced as readings returned to acceptable ranges, the monitors shifting from their urgent warnings back to steady beeps that signaled danger past, at least for now. Dr. Hargreaves stepped back from the table, his gloved hands raised in a gesture of exhausted relief, his chest heaving beneath his surgical gown as adrenaline drained from his system and left him visibly shaken. The invincible surgeon suddenly looking very human and very mortal in the harsh light of consequence. Through the observation window, Mayor Richard Whitmore stood frozen, his face pressed close to the glass. His hands splayed against the surface as if he could somehow reach through the barrier and protect his wife from the crisis unfolding before his eyes. He'd been watching the routine procedure from this vantage point, standing where surgical staff had positioned him with assurances that gallbladder removal was one of the safest operations performed, that his wife would be in recovery within hours, that there was nothing to worry about. They'd allowed him this observation spot as a courtesy to his position, a small privilege afforded to men whose names carried political weight, whose connections could influence hospital funding and public perception. He'd watched the initial preparations with detached curiosity, the clinical choreography meaning little to him beyond the abstract knowledge that these were competent people performing a necessary task. But then everything had changed. The sudden shift in body language among the surgical staff, the explosion of alarm sounds, the visible panic as his Eleanor had convulsed against her restraints, her body rejecting something in a violent cascade that transformed her from peacefully sedated to critically endangered in seconds. Richard had shouted her name, had pounded against the observation glass, even though nobody inside could hear him, had felt the sickening powerlessness of watching catastrophe unfold with no ability to intervene, to help, to do anything but bear witness to his wife's suffering while medical professionals fought to reverse whatever had gone so terribly wrong. He'd seen the young nurse earlier in the hallway, had been present for part of the exchange between her and Dr. Hargreaves, though at the time he'd paid little attention to what seemed like routine medical communication. But now, replaying those moments in his mind with the terrible clarity that comes from watching consequences materialize, he remembered her urgency, her repeated attempts to communicate something about Eleanor's chart, the way Dr. Hargreaves had dismissed her concerns with visible impatience. Richard had spent decades in politics, had learned to read body language and power dynamics, to see the invisible structures that governed how information flowed through institutions, and he understood with sudden, searing clarity what had happened here. The young nurse had tried to warn them, had attempted to prevent exactly this crisis, and she'd been overruled by a surgeon whose ego couldn't accommodate the possibility that someone junior might see something he'd missed. Eleanor had nearly died, was perhaps still not entirely out of danger, though the immediate crisis seemed to have passed, because institutional hierarchy had valued credentials over observation, experience over evidence, a doctor's pride over a nurse's vigilance. The realization sent fury coursing through Richard's veins, hot and clarifying, burning away the paralytic fear that had gripped him since the alarms began their awful chorus. He turned from the observation window to find the young nurse still standing in the hallway, her face pale, her eyes wide with a mixture of relief and residual terror, and he crossed the distance between them in 3 long strides. "What's your name?" he demanded, his voice rough with emotion barely contained, and she startled at his approach, her professional mask slipping to reveal the young woman beneath, still visibly shaken by what she'd witnessed. "Lila Carter, sir," she managed, her voice small but steady, and Richard saw in her face the weight of someone who'd been proven right in the worst possible way, whose warning had been validated through near tragedy rather than prevented disaster. He wanted to rail at her for not fighting harder, for not physically blocking Dr. Hargreaves from administering the medication, for not finding some way to force them to listen before Eleanor's body had convulsed on that table. But he'd been in that hallway too, had heard the surgeon's dismissal, had witnessed the power dynamic that made resistance almost impossible for someone in Lila's position, and his anger found its proper target. "You tried to warn him," Richard said, the words somewhere between question and statement, and Lila nodded, her throat working as she swallowed against obvious emotion. "I saw the allergy notation on her chart. It was marked clearly in multiple places. I informed Dr. Hargreaves before he administered the antibiotic, but he—" She trailed off, unwilling or unable to articulate the full scope of what had been dismissed, and Richard felt something crack in his chest, some fundamental assumption about how systems worked when competent people were in charge. Behind them, the operating room doors opened and Dr. Hargreaves emerged, still in his surgical gown, though he'd removed his gloves and mask, his face carrying an expression Richard couldn't quite read. Relief, certainly, but also something defensive, a man already constructing explanations and justifications. He approached Richard with condolences already forming on his lips, ready to frame what had happened as unpredictable medical complication rather than preventable error. But Richard held up a hand to stop him before the first word could emerge. "Did she warn you?" Richard asked, his voice low and dangerous, gesturing toward Lila, who stood rigid beside them. "Did Nurse Carter inform you about my wife's penicillin allergy before you administered that antibiotic?" The question hung in the air between them, sharp and unavoidable, and Richard watched Dr. Hargreaves's expression shift through several configurations before settling into defensive formality. "Mayor Whitmore, medical decisions are complex, and while Nurse Carter did express concerns, I made a clinical judgment based on years of experience." Richard cut him off with a sound that was half laugh, half snarl. "Your clinical judgment nearly killed my wife. Your experience was worth less than nothing when faced with a clearly documented allergy that a 24-year-old nurse saw and you dismissed. How many years of experience does it take to read a red warning sticker?" The hallway had grown quiet around them, other staff members pausing in their routines to witness this confrontation between political power and medical authority, the usual hierarchies suddenly inverted as a mayor held a celebrated surgeon accountable for an error that nearly cost everything. Dr. Hargreaves opened his mouth to respond, then closed it again, his defensive posture crumbling slightly as the reality of his mistake and his stubborn refusal to acknowledge the warning that could have prevented it became impossible to rationalize away. "I apologize, Mayor Whitmore," he said finally, the words sounding like they were being extracted with pliers. "The situation should have been handled differently. I should have listened more carefully to Nurse Carter's concerns. It was barely adequate, fell far short of accepting full responsibility, but Richard could see in the surgeon's eyes that something fundamental had shifted. Some part of his invincibility armor had cracked. Richard turned back to Lila, seeing her properly now, not just as a hospital employee, but as the person whose vigilance and courage had potentially saved Eleanor's life, despite every obstacle placed in her path. "Thank you," he said simply, and watched her eyes fill with tears that she blinked back furiously, her composure hanging by a thread. "I just wish I could have done more, said it louder, found a way to make someone listen before—" Richard shook his head, cutting off her self-recrimination. "You did your job. You did more than your job. You saw what everyone else ignored, and you tried to prevent it despite knowing it could cost you. That's not failure. That's exactly what nursing should be." The words seemed to release something in Lila, some tightly held grief or guilt, and she nodded once, sharply, accepting his absolution even as her face remained etched with the strain of the last hour. Around them, the hospital was slowly returning to its normal rhythms, the crisis past. Eleanor stable enough that the surgical team had decided to postpone the gallbladder procedure and focus instead on monitoring her recovery from anaphylaxis. She would need to be watched carefully for the next several hours, her body still flooded with histamine and inflammatory markers, still vulnerable to secondary reactions, but the immediate danger had receded. Richard made a mental note to personally ensure that this incident was thoroughly investigated, that protocols were reviewed, that the institutional culture that had enabled Dr. Hargreaves's dismissal of legitimate concerns was addressed at the highest levels. He'd spent his political career navigating complex systems, understanding how power flowed and where it accumulated. And he recognized in this near tragedy all the patterns of institutional failure he'd seen in other contexts. The way hierarchy could block truth, how deference to authority could override evidence, how the voices of those with less power got systematically ignored until disaster forced recognition. But he also saw in Lila Carter something that gave him hope, a young professional who'd risked herself to protect a patient, who'd found courage despite intimidation, who'd proven that wisdom didn't require decades or titles, only attention and integrity. Dr. Hargreaves retreated back toward the operating room, his shoulders carrying a new weight, his legendary confidence visibly diminished by consequence. And Richard wondered how many other times the surgeon's dismissiveness had gone unchallenged, how many other junior staff members had swallowed their concerns rather than face his imperial displeasure. The culture would need to change, not through policy memos or training sessions, though those would come, but through moments like this one, where the cost of arrogance became undeniable, where ignored voices were finally heard, not because systems designed it that way, but because crisis forced acknowledgement. Richard looked at Lila again, this young nurse who'd carried the burden of knowing catastrophe was preventable, who'd watched it unfold despite her best efforts, who stood now exhausted and vindicated and still clearly processing the trauma of the last hour. "What happens now?" she asked quietly, and Richard heard in her voice the uncertainty of someone who'd just challenged institutional power and won, but didn't yet know what victory would cost her. He wanted to promise her that everything would be fine, that she'd be celebrated and protected, that speaking truth to power came without consequence. But he was politician enough to know that change was messy and slow, that institutional cultures defended themselves even in the face of clear failure. "Now we make sure this never happens again," he said instead, the promise carrying the weight of his position, his connections, his determination to transform this near tragedy into systematic improvement. The fluorescent lights hummed overhead, indifferent as ever to human drama, as Lila Carter and Mayor Richard Whitmore stood in the hospital hallway, surrounded by the aftermath of crisis narrowly averted. Eleanor would recover, would eventually have her gallbladder removed by different hands, would return to her life with a new understanding of how fragile the line between safety and disaster truly was. Dr. Hargreaves would face consequences, professional review, scrutiny of his practices, a permanent mark on his otherwise sterling record, and hopefully emerge humbled, more willing to listen, less certain of his own infallibility. But it was Lila's face that Richard kept returning to, seeing in her the embodiment of everything healthcare should be: vigilant, courageous, patient-focused despite personal cost. She'd been ignored and dismissed and proven devastatingly right, had saved a life not through dramatic intervention, but through simple, stubborn insistence that evidence mattered more than ego. "Thank you for fighting for my wife," Richard said again, needing to articulate the gratitude that felt too large for words. And Lila nodded, accepting the acknowledgement, even as her eyes drifted back toward the observation window where Eleanor lay recovering. "It's what we're supposed to do," she said quietly, and Richard recognized the truth in that simple statement. Yes, it was exactly what healthcare professionals were supposed to do, and yet how often did institutional pressures and power imbalances make that simple mission impossibly complicated? The hospital continued its endless cycle of healing and crisis around them, each room holding someone's story, someone's fear, someone's hope. And Richard understood with new clarity how much trust patients placed in these systems, how devastating the betrayal when that trust was nearly fatal. But he also understood that change was possible, that voices like Lila's could be amplified rather than silenced, That near tragedy could become catalyst for transformation if the right people paid attention and refused to let the moment pass without meaning.